We know this is what Hospice of New York City was providing for you. We get that arrangement, and then we set up a transfer date. I'm flying down or I'm driving down. We have patients that take boats down from up north, that fly, that take the train. We've had, it's quite expensive, but we approximately 3 years ago, I've been with Hope about 3 years, I had a patient who was in the Netherlands, and the family wanted him to die in the States, and the majority of the family was there. They transferred that patient from a hospice in the Netherlands to Florida, to Hope Hospice, via an ambulance jet. What we have to make sure happens, and what our responsibility is in a transfer, is that we know what your needs are when you arrive. So we're able to go out and meet your needs. We try our best not to have a gap in your care. So the hospice that's transferring you, it's their responsibility to make sure you've had all your medications, you're ready, your plan of care was sent to the receiving hospice. Does that answer your question?
Yes, because the term joining hospice, when you join hospice, you said earlier.
Okay, what that means is you have to elect to use your benefit.
Okay.
Right, right, right. I try to, as a nurse, sometimes I try to avoid the business words, you know, hospice appropriate and electing benefits, and so I like to see you as joining in, you know, so I hope that cleared that up for you. Okay, okay. Yes, come join the club. And you can leave. We've had patients that decide, you know what, I'm just feeling better, and we've had that happen. And that's another myth, is people think I elect hospice, I join hospice, and that's it. You know, I mean, a majority of our patients do, but we have patients, I've had several patients on teams that I've managed that come on hospice, leave, come back, leave. It all depends on what your goals of care are. That's important to know.
Tell me with terminology.
Sure. Palliative care means comfort. Something as simple as putting a Band-Aid on a skinned knee, or, you know, remember Bactine spraying the knee and cleaning it? That's palliative care. So like Carol said earlier, all hospice is palliative care, but not all palliative care is hospice. Palliative care means we're taking care of your needs. We're providing you comfort. Hospice is a specialized palliative care need to manage what happens when somebody's faced with a terminal illness. What separates hospice from palliative care is we're not just addressing your medical issues, we're also addressing your psychosocial needs, your spiritual needs. That's a huge part of hospice that people forget about. The dying process is not just your heart rate and your breathing and your pain. There's also the whole spiritual piece of that, and we can provide support there as well. And we're specially trained as nurses. There are nurses that get certified in hospice care, that receive specialized training, and physicians board certified in hospice care. So we become experts in managing the symptoms, but there's everything else behind that as well.
I have a friend who had a serious stroke 2 days ago.
Oh, sorry.
He was taken to a hospital, and now he's in the hospice in Englewood. Is that a part of your network?
It's a separate organization, but there are a number of hospices that work together in a national hospice work group, so there's constant communication.
He's in the physical, the one in Englewood.
Right. It's a different organization.
If you have relationships, if I feel he's not being taken care of, I can speak to you people.
Well, we're licensed to provide care in Lee County. Yeah.
You would still help.
We'd be happy to answer any questions that you have.
I don't know how long it will last.
Yeah.
He's a friend, I want him to get the best care.
Right.
In that respect,
Sure.
am I correct in that if you go to a hospital and are discharged
No, hospices are licensed by counties. The state allows hospices to practice in counties. Different states do it in different ways. In Florida, it's based on what the need in that county is. So if you can choose to go to any hospice you would like to go in, but if you're discharged in Collier County and you live in Collier County, then you're going to be taken care of by the hospice that's licensed in that county. Now, we've had patients that leave Collier County and come to Lee County to stay with family or to stay with friends because they want Hope Hospice, and the same could be said about any hospice. I hope that didn't confuse you more, but
I think my question was intended because I think it's a misunderstanding. And I've heard people say that if you're in an inpatient hospital and you get discharged directly from the hospital to hospice, that you would use the hospice service that's for that hospital. Okay, but it's not necessarily.
that's not necessarily the case. Absolutely.
I think that also contributes to the misunderstanding of that there, because probably the majority of hospital stays for people in Boca Grande will be in Charlotte County or Sarasota County.
Right.
Rather than, I mean, there are some, but I would say the bulk probably either are in Englewood, Venice, or Sarasota. And people would say, well, if you're discharged, then you've got to, then you would go to Tidewell. But if you're in
You can choose to go wherever you want, but exactly. But if that's hospice is a Medicare benefit and you elect that care, there are different hospice organizations that are licensed to provide that care, and different states do it differently. In Florida, you're licensed by your county. Yeah, I'm not. It's based on where you pay your taxes. However, if you choose, we have patients that live in Collier County, and they go to the Collier County Hospital, the Naples Hospital. But we've had many patients that decide, I had friends that had, I'm speaking from experience, that had Hope Hospice care. So they go and they live with their friends and so on in Lee County, so we can provide that care to them. Yeah.
Okay, I can give you real specifics. If you want hospice in your home, if let's say you wanted hospice in your home for a while, we would provide that to you because we're licensed to do business in Lee County. Now you are having more acute symptoms. You can elect to go to any hospice house you want, whether it's in Timbuktu, Naples, Florida, or Cincinnati. It is your choice. But you get admitted, okay, so this sounds like gobbledygook, but what happens is you get admitted. We would discharge you from Lee County. We would facilitate that communication so you could go to Timbuktu and you would get re-enrolled in their hospice. We have a situation right now where somebody is not satisfied with the quality of care they're getting in their Naples area. There are multiple hospices there, so I'm not singling anybody out, but they're not satisfied. This particular patient will be discharged from there, and they will come to a Lee County hospice facility. They will disenroll, and they will re-enroll, but this is not bitterness between the organizations because you always honor patient wishes first. So that area that dissatisfied, they'll discharge, we'll enroll, we enroll them in Lee County. We enroll them in Lee County so that it's technically legal. It's not shenanigans. It happens to facilitate what? Patient need. In your situation with your gentleman, your friend that's in the hospital, and he's not getting care, was that you, sir? Which one had the friend with the stroke? I'm sorry, because my back was turned to you. A friend, yeah, you don't have a stroke, you have a friend. And he's lucky to have you. If you have a question or concern about what's going on, feel free to give me a call. I'll give you my card, and I'll guide you to the best of my ability to make sure he gets the care and service that he needs, whether it's in our service area or not. It's not relevant. You're welcome. Yes, ma'am.
So you would handle the placement in the proper inpatient hospice place, not our clinic?
That's correct.
Okay.
When somebody's deemed hospice.
We live in, which happens to be live, we would contact you at Hope.
Correct.
Okay.
And
You would handle
our
and
our goal is that the Boca Grande staff and the Hope staff become commingled and comfortable with each other. That's when we talked about, and John talked about earlier, training and collaboration, so that you're getting the same answers from whether you're talking to us, you're talking to our Tidewell counterparts, or you're talking to the Boca Grande Clinic. The goal is to make it easier, not more complicated. So the answer on your friend that's in the hospital, let me know. I'll do what I can to figure out what the right resources are for that person at that point in time in their life. If you try to eat a whole pizza at one time, it makes you sick. If you take a slice at a time, it tastes pretty good. And our goal is a patient at a time, a slice at a time, and do everything we can as frequently as we can with quality and care and compassion. And so this end of the presentation gets a little complicated because you're getting into specifics. All you need to know is that every hospice at its root wants to do what's right for you. Every hospice. And some hospices have different levels of service based on their needs, their geography, etc. It's our goal to help you get what you need as expeditiously and for as long as possible. Yes, ma'am. One more question. One more here. I believe actually in our regulatory environment that's getting more pervasive, it's actually failure to thrive is being used less versus more. That in order to substantiate payment and to make sure that hospices, hospitals, et cetera, dot their I's and cross their T's, that you're very specific with the diagnosis, very specific with the treatment, very specific with the need. Michael, do you disagree?
No, for somebody to have that diagnosis of failure to thrive, there has to be, there just has to be very specific data. There's criteria to use diagnosis. So yeah, we do see patients with the failure to thrive diagnosis. We just have to be very specific as far as what information we gather about the patient, so we can support that diagnosis. So, but we do, yeah, failure to thrive is a diagnosis that we use.
One other thing, if we don't have Medicare, you said something about private insurance?
There are private insurances that do offer a hospice benefit. Most of them do follow the Medicare guidelines. Their guidelines are similar. They may not follow the benefit periods like that way, but.
I have a real quick question for Carol. In that example you gave of the patient who wanted to see her daughter get married, did you guys manage to find a husband for her? Thank you.
That was a good laugh at the end of a very serious topic, and I want to say thank you for that. I've got my business cards. I'm going to leave them here and pick one up if you have an issue, concern, need, you need something additionally, and John has a stack and knows how to reach us. It's really been our pleasure. Thank you very much. We really, really appreciate it.